In today's rapidly evolving healthcare landscape, the need for well-trained and highly skilled doctors has never been greater. As the demand for healthcare professionals continues to rise, it is crucial to ensure that the next generation of doctors is prepared to meet the challenges of tomorrow. The IA Clinic Fellows Program was created out of 25 years of experience in externship training of international medical graduates, or IMGs, at the clinic. The program focuses on providing IMGs the exposure and training required to become highly competitive in successfully matching into residency training programs, followed by continued mentorship and guidance in their progress through residency toward becoming successful in private practice.
The Fellows Program has three broad areas of focus. 1. Externship training. 2. Continued mentorship. And 3. Practice development. 1. Comprehensive externship training. The program begins with a full-time 4 to 8 week hands-on in-person externship training program dedicated to training an international medical graduate in the necessary skills to become competitive in securing placement in a US medical residency program. IMG are treated and introduced to patients as doctors in training and are allowed hands-on interaction with patients under supervision. Activities and skills include conducting history and physicals, performance of EKGs and discussing findings with the attending, presenting case reports to the attending, participation in retina scans in the diabetic clinic, GLP-1 mediated metabolic and weight management, observation of exercise cardiac stress tests and transthoracic echocardiography, review and discussion of lab data, coaching and presentation skills and general engagement in the clinical care delivery exactly as would be expected of a trained professional in advanced training. 2. Continued mentorship. Graduates of the IA Clinic Fellows Program are eligible to enroll and participate in the Fellows Alumni Mentor Network that will continue to support them with resources and guidance throughout their residency and fellowship training. 3. Post-residency practice development. The alumni of the Fellows Program may avail of the Fellows Alumnus Post-Residency Practice Support Program, which will teach them the essentials of setting up a successful primary care private practice after they complete their residency training. As an IA Clinic Fellow and Extern, you will be trained in all aspects of the caregiving process in an outpatient setting. You will work closely with experienced doctors and healthcare professionals who will not only teach the technical skills you need, but also instill in you the importance of empathy and compassion in patient care. Each cohort of fellows is restricted to 3 or 4 candidates who will work beside Dr. Iyer and the clinical team at the Herndon and Stone Springs location of the Iyer Clinic in Northern Virginia, USA. Fellows receive guidance in the entire application process, including how to write a compelling statement of purpose letter and in successful interview skills. The ability to present medical cases with confidence, authority and fluency is an essential skill that is sought after in medical residents. At the Iyer Clinic, fellows are trained during their externship in presentation and public speaking skills. During their training, they will be coached in presenting cases with dynamism, authority and skill. A video portfolio of their presentations is optionally available to the trainees for them to provide to residency program directors as a visual example of their clinical skills, which provide a compelling record of the fellows' proficiency in a manner that distinguishes their applications from the rest of the crowd. The Iyer Clinic commitment to their trainees extend past their externship. As an Iyer Clinic Fellow alumnus, they receive access to critical mentorship even during their residency to ensure their continued success in the cutthroat competition of American residency programs. Finally, our commitment to an Iyer Clinic Fellows Program alumnus extends into their practice as licensed medical doctors. We offer our alumni critical advice and access to knowledge on how to set up successful primary care practices. From website design to marketing and content creation, our alumni have access to vital knowledge that other doctors spend hundreds of thousands of dollars to acquire. Not every international medical graduate can become an Iyer Clinic Fellow. Prerequisites for selection include prior completion of the American Step 1 exam. Selection is done through an interview process that is conducted in person or via Zoom teleconference. Selected candidates will need to present proof of clearance from pulmonary TB. International medical graduates who have completed Step 1 or higher and are desirous of entering the IR Clinic Fellows Programme as an extern may email an application letter and a copy of their CV to fellow@irclinic.com with a request for the programme brochure. Successful applicants will be invited to attend a selection interview in person or via Zoom video conference. Email your cover letter requesting programme brochure and application form along with your CV as the first step to being considered for the IR Clinic Fellows Programme.